Hi everyone, it's Alice here, one of the pelvic floor physios at Alchemy in Motion. I just wanted to quickly have a chat to you about why it's so important to see a pelvic floor physio before having a prostatectomy, which is where you will have the prostate removed after finding out that there is some cancer within the prostate. So this is a really common surgery now that they have done an awful lot of research into, and the effectiveness of the surgery is very high. However, one of the downsides of having this surgery is that in the removal of the prostate, a lot of men can experience some troublesome urinary leakage, among a couple of other symptoms. But just in this video, we'll be talking about the urinary leakage. Now, the reason why a lot of men experience this urinary leakage is that there's essentially a kinking mechanism within the prostate that senses when there's urine in the bladder, or when you stand up or sit down or bend and lift anything, there's a pressure change within the abdominal cavity. Now, this kinking mechanism and this reflex within the prostate actually picks up on that, and there is a kinking mechanism that actually closes off around the urethra, which is the tube that carries urine from the bladder. Now, when there's urine in the bladder and this kinking actually occurs within the prostate, therefore the urine doesn't, leak out or slip out. However, after the surgery, after you've actually removed the prostate, that mechanism is no longer there. So now you have to rely on your pelvic floor to be able to switch on and actually close off the urethra and kink the urethra, therefore stopping any urine from coming out. Now, if this muscle has never really worked in its life, it doesn't really know when it needs to switch on and when it needs to switch off, and it doesn't know how to recognize pressure changes, unfortunately, this is when you can experience some leakage. So this is the role of a pelvic floor physio, is actually teaching you how to identify these muscles, how to squeeze them effectively, and then how to strengthen them into not only isolated positions, but then also into functional positions. So what I mean by that is when I'm standing up from a chair, when I'm bending over, lifting anything up, and when I'm laughing and coughing and sneezing. So if you have any concerns surrounding urinary leakage, or you know of someone, or you are yourself about to go in and have one of these operations, it's best to come in and see one of us in clinic to get your pelvic floor assessed and for us to be able to identify what's going on. If there are any questions, please don't hesitate to contact us. We look forward to speaking to you soon. Bye.